Briefly before we begin, for those who don't know, this webinar is actually part of a weekly webinar series that we do at MSDC called Washington Healthcare on Wednesdays. Every week or so, we have a different healthcare topic, and past topics have included things such as practice reopening, women's health, and imposter syndrome in medicine. And next week, our session will be how to be your own boss as a physician entrepreneur. And then in a couple of weeks, we are pleased to announce that on October 8th, we will have a session with the president of UNESCO, the commission in Switzerland, and who was also the former Secretary of Health of Switzerland, who will be talking about the Swiss healthcare system, in case that is of interest to any of our attendees today. And finally, I'm pleased to announce that MSDC will have its annual meeting on October 30th. Our guest speaker, which you're just announcing, is Dr. Roger Mitchell, who will be familiar to many of you, the Interim Deputy Mayor for Public Safety and Justice, who will be speaking on the topic, Medicine Goes Beyond the Exam Room, How Physicians Impact Societal Issues. A couple of housekeeping tips before I turn it over to the people you're here to hear from. This session is being recorded. That is to allow people who are unable to join us tonight to view this important information. You are on mute currently. We are asking that if you have any questions or comments to use the chat box in the Zoom app. In order to ask us questions, you can ask directly to myself or any of the presenters, or you can ask a question to the room. But if you have any questions about tonight's presentation, please ask through the chat box. And that's it for me. I will be back for the Q&A session. It is now my pleasure to turn it over to our special guest, the Chair of the Board of Medicine for DC, Dr. Andrea Anderson, and the Executive Director of the Board, Mr. Frank Meyers. Take it away.
Thank you so much for this opportunity to address the DC licensees and all of those who have attended this webinar. We are excited to bring greetings from DC Health and from the Board of Medicine, and to try to break down some of your questions and concerns regarding the upcoming renewal cycle. As mentioned, I'm Dr. Andrea Anderson. I am the chair of the DC Board of Medicine. I was a physician member of the board for several years and have been the chair for the past 3 years. I also sit on the Ethics and Professionalism Committee of the Federation of State Medical Boards. And I'll turn it over to my colleague, Mr. Frank Meyers.
Good evening, everyone. My name is Frank Meyers. I am the Executive Director for the Board of Medicine. In my new role, I am the Associate Director for the Office of Health Regulation, for the Office of Health Professional Licensing Boards at the Health Regulation and Licensing Administration. In addition, I sit on the Board of Directors for the Federation of State Medical Boards. I echo Dr. Anderson in thanking everyone for participating and joining us in this informational session for the 2020 Board of Medicine renewals. I'll turn it back over to Dr. Anderson.
Thank you. Next slide. So we wanted just to give you a frame of where we're coming from. I know everybody wants to get to the nuts and bolts. What do I need to do? When do I need to turn it in? How do I do so? And we're definitely going to get to that. But just to give you an overall idea of what the Board of Medicine does and what DC Health does. And just to start out, DC Health is the District of Columbia's Department of Health that has the large goal of promoting health, wellness, and equity across the district. It's the division that protects the safety of residents and visitors and all of those doing business here in our nation's capital. Within DC Health, there is something you may see known as HRLA. Sometimes you see that on the top of any mail you get or on the website. Health Regulation and Licensing Administration. Okay, so the mission of HRLA is to protect the health of the residents of the District of Columbia also. But by doing that, those who also do business here by fostering excellence in health professional practice. Things like building quality, safety in healthcare systems, facilities. So kind of brings it even into a smaller focus. And within HRLA, there's us, which are the Board of Medicine. And our charge is to protect and enhance the safety, health, and well-being of District of Columbia residents by promoting evidence-based practices in healthcare regulation, high standards of quality care, and implementing policies that prevent adverse events. And we do that by licensing you, our qualified healthcare practitioners and professionals. Next slide, please. This is just a general overview, obviously pretty large here and lots of little boxes, but here we are located here in the lower left-hand corner on my screen. And so you can see how we are just one division within a division of DC Health. So there's a lot going on, and DC Health is doing many, many wonderful things across the district. And here in the Division of Medical Boards is where we are today. 15 members sit on the Board of Medicine by statute. That includes 10 physician members, 4 consumer members. You might hear them called public members. Also, some other boards call them public members. Here in DC, they're referred to as consumer members. And then there's 1 member of the board that is the designee of the director of the Department of Health. And so here lists the current membership. The goal of MODA, which is the organization within the mayor's office that appoints board members, is to have a representative sample of the physicians or the other members that that board is licensing and regulating. So here on our board, we have a vast array of different specialties. Like I'm a family physician, we have surgeons, we have psychiatrists, we have emergency medicine, an epidemiologist. So we have a vast array of specialties so that when we look at cases or we consider policy, there is an array of physician experience and expertise represented on the board. You may also see that the number only goes to 14. So that means there is a 15th vacant spot right now on the board. And I'm going to talk about that a little later in the presentation. Just general to give you perspective of what we're doing in the Office of Health Professional Licensing Boards. Board of Medicine is not the only board. There are 72 licensed professions, close to 90,000 active licensees in the District of Columbia. And not just doctors. We're talking about veterinarians, we're talking about social workers, marriage counselors, pharmacists, many, many, many specialties and licensees exist, all for that thing that I talked about in the beginning, right? Protection of the public, protection of the health of the residents of the District of Columbia. And so just to give you an idea, there's about 50 staff members that exist within OHPLB, processing all of your applications and answering questions and keeping up with emails. Next, please. When we talk about the actual Board of Medicine, we receive approximately 2,000 new applications a year. We have approximately 14,000 licensees. Of that, 11,000 are physicians, MDs or DOs. But that leaves another 3,000 licensees, and many people don't realize that the Board of Medicine not only licenses physicians, it also licenses trainees. Those are the MTL, medical training licensees. So those are the residents. We license MTRs, medical training registrants. So those are students or residents that, just residents that come into the district on a temporary basis. So if they have like a 2-month rotation, 3-month rotation, something like that, they're doing a short stint during their fellowship and they need a temporary license. More than 90% of the application are approved within 72 hours. And that's a big number for a small staff and many licensees and many applications. Now I know sometimes there's delays for various reasons, and Frank's going to talk about many of the modifications that we've done because of the COVID-19 pandemic. But we do know that sometimes there are delays, and we do acknowledge that. But I can assure you the staff is very hardworking, and they're trying their best to get through all of the paperwork that is presented on the Board of Medicine. And an interesting fact is less than 10% of the applications go before the board for additional review. So I, as the chair, and my other members who sit on the Board of Medicine, we only see about 10% of those 2,000 applications a year. And that's actually a good thing. I say to some people sometimes, they'll say, hey, approve my license. Oh, I just submitted my license. Actually, it's better if the board never sees your license, because that means it was a clean license, it went straight through, the staff was able to approve it. And we only see the licenses that have a question. We call that an encumbered license. So if there's a concern about how you answered a question, or there's something that the staff has flagged for review, those are the license applications and renewal applications that rise to the level of those 14 members that I presented to you earlier. Each state medical board is governed by their Practice Act. Here in the District of Columbia, our Practice Act is called the HORA, the Health Occupations Revision Act of 2009. And, you know, hey, one night if you are so inclined and you want to read the HORA, we've included a link here for you to look it up. But essentially, it determines what is considered the practice of medicine within this jurisdiction, which is the District of Columbia. What do we go by? What are our regulations that we are judging applications against? And we also mentioned that within the Board of Medicine, we don't just license physicians. There's other professions that are licensed through the Board of Medicine, and that includes physician assistants, anesthesiology assistants, acupuncturists, surgical assistants for those surgeons that are on the call, naturopathic physicians, polysomnographers, trauma technologists, and also athletic trainers. So there's a whole range of licensees that fall under the jurisdiction of the Board of Medicine. And I should say that we do have a number of advisory committees. So if there's an issue that comes up with one of the areas that's not represented by the membership on the board, we can consult advisory committees to help us determine what is standard practice among trauma technologists, for example, or acupuncturists. You know, is this something normal that would happen or not? So we do work not only on the board, but also with our network of experts and advisors to help license a competent workforce to protect the public in DC. This just gives you an idea of our current licensure census. And you see we're close to 16,000 licensees currently licensed by the DC Board of Medicine, all of whom have to renew this renewal cycle. Next. So before we get to the renewal process, just to let you know, licensure renewal is not the only thing that the Board of Medicine does. And I know people often think of Board of Medicine as just licensure, but we also handle policy. If you go back to that initial slide, not to go back, just to reflect back on the initial slide, we talked about evidence-based policy and evidence-based medicine in the assurance of the health of the public. And one way that we're accomplishing this is through a new initiative called the Interprofessional Collaboration Chair Committee. And that is a committee that's been formed. Actually, this is our last in-person meeting, which was the month before the public health pandemic was declared. But these are a sample of the chairs of the various boards. So here you see represented the chair of the Board of Nursing, chair of the Board of Pharmacy, chair of the Board of Veterinary Medicine, and a few others that weren't there in present, but were represented on a virtual call. And the chairs have been meeting under the direction of the DC Chief of Staff, Dr. Jacqueline Watson, at the request of the Director of Health, to align the practices of the board in accordance with DC public health priorities. So that's something that's going on, just to bring to your attention. We also have various subcommittees that are working on various policy initiatives for the Board of Medicine. And I listed a few here. One is tightening up our regulations on self-prescribing and prescribing for family and friends, which is something that comes up often. And some boards have no regulation, some boards have some regulations. So we're looking at what are the DC regulations and how can we make that more clear for our licensees. And physician sexual misconduct is another topic that we're looking at. Actually, nationally, all the member boards of the Federation of State Medical Boards are looking at this. A national report recently came out with regulations for how boards should handle physician sexual misconduct. And we're forming a subcommittee on the board to review the recommendations of that report and look at our DC policies in accordance. I'm going to turn it over to Frank to talk about some of the changes that he and his staff have been able to do to keep the workings of the Board of Medicine going during this public health pandemic.
Thank you, Dr. Anderson. And before I start, I'm going to just remind everyone that's joined us throughout this presentation to please mute yourself as you enter the room, just so we can avoid any audio feedback or issues like that. So COVID response. COVID has changed life for everybody, and the Board of Medicine and the Department of Health are no exception. In fact, the Department of Health has been leading the charge in combating COVID in conjunction with our private partners at the various hospital facilities and healthcare facilities throughout the district. And so together we've been doing our best to combat and lower the spread as much as possible. Here at the Office of Health Professional Licensing Boards within HRLA, that has included re-examining our licensure application process. Most of you, since you're all licensed in the district, have gone through our licensure process, and as you know, it is a paper-based process. And unfortunately, to process paper, you need people in the office to do that. And so we have had to transition a paper-based process quickly to a digital one during this time. And so this has required adoption of certain programs and suites of programs such as Office 365, Microsoft Teams, and development of a new electronic licensure process via a system called Salesforce. And in fact, our renewals already are on the Salesforce platform, but we are actively developing a system for processing initial applications, which we hope to show off to the public here in the near future. We've had to modify our customer service because our staff is not in the office. There's no one there to take phone calls. So we do realize that some individuals, obviously we've not stopped paying our phone bills, so our phones still work. But if you are trying to call our office, there's really not anyone there to get a hold of. So on our Board of Medicine website, we put up several emails for the people who are the best points of contact regarding applications and various processes, such as verification requests and other items. We've also asked our licensees to go to our licensure verification website. So if you're applying to another state and they want verification of your DC license, we encourage those jurisdictions to check our website. We do consider it primary source verified, and it is available and it is a free service. Because our offices are close to the public, we don't have walk-ins. In the beginning, we did have to create a modified walk-in schedule by appointment only. We have looked at and are continuing to look at new scheduling systems to kind of create virtual walk-in hours, if you will. Essentially a digital, kind of like a digital open door where individuals can stop by, get a hold or schedule a phone call with the licensing specialist to discuss the status of your application. We've also looked at transitioning board meetings from in-person, physical, face-to-face meetings to digital ones, or virtual board meetings as we call them. We've done that through the use of WebEx, which is similar to Zoom, but it's a different platform. We've utilized SharePoint, which is a product through Office 365 for the sharing of documents and records. And lastly, we continue our enforcement actions. While investigations have changed a little bit and we've done a lot more things through electronic exchange of documents and virtual interviews through Microsoft Teams and other platforms, we do still conduct those. We still do investigations, we still do interviews, and we've even held virtual hearings. The Board of Medicine has not yet done this, but the Board of Nursing and the Office of Administrative Hearings continue to schedule virtual hearings. So we continue to respond to COVID, and we'll continue to do so until it is hopefully gone from our lives in the year 2021, but we shall see. So renewals, this is why we're here tonight to talk about renewals. So renewals for the Board of Medicine are biannual, meaning they happen every 2 years. This is one of those years. Licenses will expire. All licenses under the Board of Medicine will expire on December 31st. All professions are renew at the same time, and the process is exclusively online. We do not accept paper renewal applications. So anyone that attempts to send in some sort of old paper renewal application they may have found online, it will not be accepted and it will be sent back. So please do not try to do so. What you see on the right side of the screen is a screenshot of our login portal for the renewals. And we have several screenshots that we're going to point your attention to kind of help demonstrate the process. So before we go into each step, I want to outline what those steps are. So the major components of the renewal are demographic information, what we also call the physician profile. This is where you can update name, address changes, things like that. We have screening questions where we ask about incidents that may have occurred since the last renewal, such as any criminal convictions, malpractice, things of such nature. We ask clean hands, make sure that you've paid your taxes to the district. We verify continuing education. We ask questions related to the workforce survey, which I'll go into more detail a little bit later. We verify the criminal background check. And lastly, we have the renewal fee paid and processed. So this is the landing page. So I mentioned earlier that renewals are on a platform called Salesforce. This is probably, I would say, this is the second renewal, I believe, through the Salesforce platform. This has been a multi-year project here at the department, and so much of this will be very similar, but there have been enhancements to make the process a little bit more user-friendly, flow a little bit easier, and hopefully be a smoother process for everybody. So this is your first landing portal when you go to our renewal website. This is what you'll see. You do see on the upper left, you see a button for apply for new application. That is not yet active, but that references our new online licensure system that we're looking for. For everyone, you'll apply for the license renewal, you'll see as the second link on the left. Once you've gone to that page, if you've not yet signed up for a renewal, if this is your first time renewing with us, you're going to have to register in the system. So you're going to have to enter your name, your email, provide your social security number and your date of birth, and that's how we verify your identity against our system. And then once you're renewed, you will get an email and it will verify your contact information. There was a question in the box about what is the website for the landing page. The website's not yet up. Once renewals go live, which will be on October 1st, we will distribute that email address on our website, as well as an email blast to all our professionals. And this is the guide, I should say, this is a guide for all our professions. All professions under the Board of Medicine will go through this process. It will look exactly the same. Some of the questions may be slightly different, but they will be, this is pretty much an identical process. So here is a larger picture of a page I showed you at the very beginning, where you'll see the login and register button. So if you get to this, obviously, again, if you already have an account, if this is your second renewal, you'll log in. But if this is your first time, you're going to have to register before you go any further. I will reiterate, we ran into some problems last time, that if you've already created an account before and you attempt to register a new one, that will cause a bit of a hiccup, which may freeze you out of the system. So we strongly encourage people to try and log in first before they register. So once you've logged in, once you've registered and got your username and password, or once you already have it and you've logged in, you'll see a portal like this. And again, you'll see another link for apply for a new license, continue your application, contact support, feedback. But what you're really looking at is right there in the middle. You'll see a list of those licenses that you have with us. And that is where you will renew that license. As you see the big red renew button, you're going to click on that renew button. And in this portal, you'll see all your license. So if you are, for example, let's say you're a physician, but you are a physician who also has an acupuncturist license, you'll be able to renew both your physician license and your acupuncturist license, and even your controlled substance registration. This gives a little bit more detail. The first thing you'll see is your license, and then you'll see the option to put your license into what we call paid inactive. And we had a lot of people that ran into this problem. Paid inactive basically means you do not want to renew your license, but you still want to keep it in a status that should you come back in the future, you want to easily get it back. So that is what paid inactive is. You pay a fee, we put you license in inactive status, so that in the future you can come back and reobtain it easier. If you want an active license, you will choose no, that you want to remain active. If you want to go paid inactive, you will choose yes, paid inactive. If you don't want to go paid inactive or anything like that, you just want to let your license expire, then you simply just don't renew your license and you just let it expire. And with every page here, there'll be several pages, but when you're done, you'll hit the save and continue button. This will take you to a next page. This is where you'll update your demographics, which is again, your name. Your name actually won't be, you cannot change. You can submit a name change request if you've been married or you have unfortunately had a divorce. This is the opposite side of that, and you want to change your name. You'll have to submit a name change request. Your social security number will be in there, but your date of birth will be in there, but you will be able to add additional information such as languages spoken, race, ethnicity, highest degree if that's changed, and such other information. This is where you have the other names used, and you can add the name changed. And you have the ability, if you do choose a name change, you do need to upload a document related to that, whether it be a court order or a divorce decree or something along that nature. You will need to upload that. And you'll notice in the last page, I'll go back one slide, there is an attached document window. This year, a lot of the feedback we got was how do individuals know their documents got uploaded correctly? You know, they say that it got uploaded, but they couldn't see it. So now you'll see a little window on the right side as you work through the application that'll show you the files that you've already uploaded. So that is an enhancement that we've done this year. Here's the update address information. The main thing I'll point out here is that you're going to have to select a preferred mailing address. It either has to be your home or your business. It can be either one. But whatever you pick will be your preferred email address, and it cannot be a P.O. box. But we still then require that you upload a business address. I'm sorry, we require a home address, and then we ask for a business address. And if you choose to upload a business address, that is what will be viewable to the public. So some individuals choose to put their home address as their business address. If you do that, that will be viewable to the public. So we just, again, a reminder that a business address should actually be your business. The home should be your home. For a controlled substance registration, I will note that you do have to upload a business address, and it has to be an address in the district. I mentioned earlier screening questions. These are several questions. This is just 2 of them for a sample, but these are questions that will ask you, for example, since your last renewal, have you ever been arrested, charged, convicted, or pled guilty to any federal, state, or statute or ordinance that constitute a felony or misdemeanor? Have you had any malpractice claims? Have you lost your privileges? Things like that. And then once you provide an answer, we ask that you type in a description. And then we also require that if you answer yes to a question that you upload a document. We've gotten questions about, so what kind of document should I upload? If it's a malpractice case, it should be a copy of a court order or malpractice claim. If it's a criminal matter, it should be a copy of the criminal arrest record or court records or court documents. Or it could just be a self-explanation on written paper, depending on one of the other questions that may have been asked. Continuing education. So for the continuing education, at the time of renewal, we are asking that you upload proof of your continuing education. And this could be, depending on how you did your hours, this could be through what we call a CE transcript. So if like with the AMA, you've got all your CE hours that are tracked through them and they issue a transcript, you can upload that, or you can upload the CE certificates individually. But you will have to state in the continuing education drop-down there whether or not you have, one, completed your continuing education, or you will have it completed. So what does that mean? So technically your license does not expire till December 31st, but you want to renew October 1. Well, that still gives you a couple months to finish your continuing education, but you want to renew now. So we will allow you to go in, select that you will have your continuing education completed, and submit your renewal application. Now, between now and December 31st, we are going to ask that you go back into the system and upload your documents into the system so that we can verify that you had your CE hours completed. But we do strongly recommend that individuals do not put a false statement there. If you aren't sure that you're going to complete your CE, don't put "I will," and then submit the application, because at that point you have then provided a false statement to the board, which has potentially caused a discipline. So if you're not sure you're going to renew, or I'm sorry, if you're not sure you're going to finish your CE, just wait, hold off, do your renewals, do your continuing education, come back, and then upload it. But all continuing education must be completed by December 31st of this year. Also, recently there was a law that was enacted that does mandate registration with the prescription drug monitoring program. As part of that law, as part of enforcement to ensure everyone is renewed, or sorry, is registered with the PDMP, we are asking everyone to answer that question. In addition to the answer to the question, to verify this information, anyone who is not registered with the PDMP by September 24th will have their license automatically put on hold in the system. So the PDMP, the Prescription Drug Monitoring Program, will submit to the Board of Medicine a list of physicians who have not yet registered. A hold will be placed on a license so that even if you go through this entire process, your renewal will be paused until it is looked at by an individual to verify that your registration with the PDMP has been completed. Unlike many of our other requirements, registration with the PDMP is mandated before you could renew. So it is not something where we would renew you and then take action later. Your license simply will not be renewed. And the PDMP registration requirement is for all people who have the ability to register, not whether or not you actually, I'm sorry, the ability to prescribe, not whether or not you actually do prescribe. So all individuals that have a license that gives them the authority to prescribe must be registered with the PDMP. Here's the workforce survey. I won't go into too many of the questions, but the workforce survey is designed to get a larger picture, a more detailed picture of our workforce in the district. We, for the Board of Medicine, focus it on our physicians and physician assistants. So other professions won't get the survey. Our physicians and our physician assistants do. And some of this information may be duplicative to stuff that you've already asked and given to us. But we are asking again, and it is a de-identified data set that we use to analyze information, as well as to help us, our sister agency in the Community Health Administration, determine health professional shortage areas. This is a Clean Hands page. The Clean Hands page is basically, as I mentioned earlier, it's where we verify you need to attest that you've completed and filed your taxes and you do not owe any taxes to the district. If you have, if you did owe taxes, but you have actually resolved it or created a payment plan, then you will need to upload a copy of that payment plan so that we can verify that that is in place and that we can go ahead and approve the renewal of your license. Criminal background check. So all licenses have to undergo a criminal background check. We do this at the time of initial licensure via fingerprint, and then we do it every 2 years at the time of renewals. The difference between initials and renewals is that we do a name-based criminal background check at the time of renewals. So this page essentially is where the licensees will consent to the use of your personal information, such as your name, address, social security number, date of birth, to perform the criminal background check. There is a $50 fee that is separate from our renewal fee that we charge for that criminal background check. If you do not agree to the criminal background check, then we do not, again, this is similar to the Clean Hands and the PDMP registration, we will not renew your license until the CBC is agreed to. Lastly, there's payments. Medicine is $805, the CBC check is $50, so that is a renewal fee of $855. Pretty self-explanatory. Enter your name, credit card, other information, and once it's submitted, we'll go ahead and process the payment and process the renewal. Here is a outline of the renewal fees for the various professions, not just the physicians, which we did. I'm sorry, not 805, but it was, here we have it as 500. And then all the other renewal fees. That was actually the initial initial application fee. And so that is an outline of the system. I'm going to turn it over to Dr. Anderson to go over the specific continuing education requirements. I noticed there's several questions that came in through the process, and we'll go ahead and answer those at the very end.
Thanks, Frank, for that overview. So we'll talk about the specific continuing education requirements, which differ for the various licensees that are licensed under the Board of Medicine. I know that most of you on this call are physicians, either MD or DOs. And as always, you are required to have completed 50 hours of continuing education credits every 2 years. And this year that includes, as in the last renewal cycle, includes 2 hours in the subject of LGBTQ cultural competency. This was a mandate by the DC Council requiring this aspect. Physician assistants, 100 hours of continuing education every 2 years, also including the 2 hours of LGBT cultural competency. Next slide. We listed some of the other requirements here on this slide. Surgical assistants, 50 hours, anesthesiologist assistants have more specific regulations, acupuncturist, 30 hours of CE. I think those are more specific, and I'm not sure how many are represented here on this call, but we do have all of these listed on the Board of Medicine website as well. So you can be clear in the amount of CEs you have to provide. There are the ones there listed for polysomnographic technologists, technicians, and trauma technologists. So you may recall that there was a requirement for 3 hours in HIV/AIDS CE. That was also a statute from the DC Council that passed in 2012. And actually, the provision of the council was that this regulation could sunset as of 2018, based on input from the mayor and input from the licensing boards. So that requirement is actually no longer required. So the 3 hours of HIV/AIDS is no longer required to be renewed. Now, of course, if you want to take CE and HIV/AIDS, that's wonderful. And if it's related to your practice or you choose to do so, that counts towards your 50 hours, but we're no longer checking to see, do you have that 3 hours in HIV education. However, as I mentioned, still under the DC Council statute, you are required to complete the 2 hours of LGBTQ cultural competency. And here we've listed 2 potential course options, which are listed here, and they're also listed on our website. So next slide, please. Now, we understand, and many state boards actually are moving away from content required CE. And for many years, the Board of Medicine has advocated for more of a categorical CE that addresses public health priorities. And we're so thankful to the Director of Health and as well as all others who have given input in that starting next renewal cycle, not this renewal cycle, next renewal cycle, regulations have been implemented for all the professions under the Board of Medicine, which will require licensees to complete at least 10% of their total required CE topics in categories that are identified by the Director of Health as public health priorities. And so we have a link there, but I can tell you they're broad public health priorities, including things like cultural competency, infant mortality, nutrition, things like that, very, very broad categories. And you'll actually, Frank, if you wouldn't mind clicking on that to open it. I don't know if you're able to see. Well, maybe not, but you'll be able to look at that for next year's for next year's renewal cycle, and you'll be able to see what some of those are for next year. But remember, you don't need to accomplish those for this year. The thing that you do need to accomplish is those 2 hours in LGBTQ cultural competency, and also 1 hour in pharmacology. Now, this is very broad, right? And we just want there to be something within your 50 CEs that talks about a medication. And it's very, very easy to accomplish that. Somewhere in those 50 hours of continuing education, someone should have mentioned a medication. And don't worry, it doesn't have to be, you know, deep pharmacology and, you know, things that you learned back in medical school. You just need to know, oh, we treat this condition with this, or here are the current topics in diabetes management, or, you know, seizure management. Here are some new anti-seizure medicines, things like that. We just need to see that medicine or pharmacology was addressed in 1 hour of your CE that you're submitting as verification that you've completed the requirement. License lookup. Several people have asked how to look up your license, and we have that on our website, and you can look and see how, if your license is active and what is its status. So this is a feature that's featured on our license. And I think you were going to talk about that, Frank.
Sorry, okay, good. I thought I was muted. Yeah, so we've, as Dr. Anderson pointed out, we've gotten several questions about how to look up our license. For those that generally routinely look at our licensure lookup, they'll know that we had a prior lookup based on our old electronic system. That is no longer the lookup to look at. This is our new lookup, which is at DOH. In fact, I'll click on the link. I don't know if it'll work or not. Nope, it's not. DOH.force.com. And if you go to the Board of Medicine's website at dchealth.dc.gov/BOM, you'll see a link on that website to our licensure lookup, and we'll provide all this information to MSDC for distribution after all of this. But that website, we're directing everyone to this new lookup. This is tied to our current renewal system. It will give the most up-to-date, accurate information as the status of your license.
We have some listed online resources for continuing education. These are ones that the board has looked at and that do fulfill the requirements. So you can look at those on our website. I mentioned earlier that there is a board vacancy for a 15th physician member. And if you're interested, you do need to live in the District of Columbia. I know many people are licensed in the district, but don't actually live in the district. That is a requirement to live in the District of Columbia, as well as several other requirements. However, if you're interested, you can go to the website of the Mayor's Office of Talent and Appointments. That's actually for all the boards and all the commissions, not just the Board of Medicine. And there's information there. We just included this one slide on duty to report. This is recent legislation that passed in April, I believe. Health professionals must report to the board within 10 business days after being made aware of the following: being named in a malpractice lawsuit, being convicted of a crime, being a party to a settlement stemming from a malpractice claim paid by the licensee, the insurer, or any entity on behalf of the health professional. And the employer of said health professional also has a duty to report. So if you are the physician owner of a small group practice, for example, and you are the employer of 3 other physicians, one of which has an action against his or her license, or has an action against a malpractice lawsuit, or something has happened to that person, you as the employer of that physician, as well as the physician, both have a duty to report within 10 days to the board that such and such has gone on, this is what's happening, this is being investigated, whatever the status is of the incident needs to be reported within 10 days. Now, there is an ethical duty to report as well if you know of misconduct or adverse practice of another medical colleague. But on the Board of Medicine here in DC, we don't have a fine that enforces that ethical duty to report. That's separate from the duty to report that's listed here. If you're the owner, or if you're the direct result or the direct impact of a licensure event or a licensure action, you have a duty to report. But say if you think your colleague in the next office over is doing nefarious things or they're hurting patients or whatever, you have a suspicion against another colleague that's not employed by you and that is not you, you do have an ethical duty to report that too, because again, the goal of the Board of Medicine is the protection of the public. And as physicians, we have the privilege of self-regulation. And with that comes the responsibility to ensure that we are all practicing ethically. And so we wanted to include that. And we definitely, in the interest of time, I know there's questions to get to, but if anyone has further questions about that, we're happy to answer. Finally, come join us. Every Wednesday of the month, the last Wednesday of the month is the Board of Medicine meeting, and the first hour is the open session. And that's where we discuss DC policy, we discuss upcoming legislation, like changes to the USMLE, you know, so many things fall under the regulation of medicine. And that's the part that we're all so passionate about, and I'm very passionate about those policy aspects that allow us to provide competent care to the district residents. So if you're interested in coming, you can come along. If you want to be on the agenda to present a topic, there is the email that you can contact one of our staffers and she can put you on the agenda. And this, I especially invite students and residents, because that is the way you're going to learn how medicine is regulated and how to get involved in helping to move forward your profession. We have several residents and students that come and really say that they had no idea and they learned so much and they get really interested. So if you're a teacher or you're working with residents or you're a resident yourself, we definitely invite you to come and be a part of the process of medical regulation. And I think that's our last slide, and we can open it up for questions at this point. I believe, yes.
All right, wonderful. Thank you both for a wonderful presentation and a lot of information. I have the joy of being able to try and condense some of these questions and also relay them, as well as questions that came in via email. So I'm going to start with an easy one, and I'm going to send this one to Frank. Can you again go through the fee schedule for the renewal? There was a couple of questions about that.
Definitely. And so I mentioned it said 805, and that was because the slides were partially from our initial system. That is the initial fee for licensure. That is not the renewal fee. The renewal fee is $500 plus the controlled substance registration. I can bring up the slide deck and go back to the specific page. 1 second. For that outlines the fees. Here we go. 1 second. Go ahead and share the screen real quick. Can everybody see that? So I'm going to apologize for that confusion. I think I gave some people some heart attacks.
All right, so $500 for the renewal and then $50 for the background check.
Correct. And then obviously if you have other licenses, the other fees would be added to that. I mentioned, you know, physicians can become licensed also as acupuncturists. The PDMP, or not the PDMP, the controlled substance registration has a fee, which you could do all in one time. You can do all those renewals at once. You don't have to go back into the system. You'll have to go through those applications, but you can then at the very end, like kind of like a shopping cart, you can do all three and pay for all three at once.
So for physicians, the cost to renew is the same as the initial cost?
No, the renewal cost is $500. The initial licensure cost is $805. That was a mistake. That was the system. The earlier slide was a picture of the initial licensure fee.
All right, great. So we have 10 minutes left. I apologize. I'm going to probably have to condense some questions. So I'm going to try and summarize some of the questions that have come into the chat. For specific questions, feel free to reach out to either the Board of Medicine, or you can reach out to us. You know, you can reach out to me directly, hey@msdc.org, and we can try and get answers to some of these. But I want to talk to, I'll send this question first to Dr. Anderson and then to Frank. There's a couple of questions about either non-practicing physicians or physicians practicing part-time or physicians practicing in different areas that may have a presence in DC. Can you all give some guidance? And this is, let me just add, this is especially important with the current COVID-19 crisis. Can you give some guidance as to what people should be thinking about in terms of license renewal, or if their practice type or time has changed in the district? And hopefully that question made sense to answer.
Yes. We encourage everyone to go ahead and renew their license if they want to maintain an active license in the district. Frank talked about the paid inactive status, and that's different if someone has retired or they are not clinically connected, they're not medically connected anymore, but they just want to maintain their license status. That's a different status called paid inactive. But if you have any connection with DC, you want to maintain your active license, you're teaching, your employer requires it, we encourage everyone to go ahead and renew their license. We don't know how long this pandemic will last, and we do know that everybody has made changes in their practice. However, we would encourage everyone to go ahead and renew to remain current in their active license status.
All right, wonderful. Thank you very much for that answer. Like I said, that's pretty important now with COVID-19 changing practice times and abilities. There's been a couple of recent questions about the PDMP, and I know that you all mentioned there's some recent changes to that due to district law. Can you just run through briefly again? If you're not planning on prescribing, you still need to register for the PDMP as part of the renewal process. And how can people find information about, I guess just kind of walk through again very quickly where on the license renewal process the PDMP part is. And
Sure. So the PDMP part is there'll be a specific question on the renewal asking if you've registered with the PDMP. And our data shows that a large percentage of our licensees already have registered, but there are some that have not. And so for those that have not, we strongly encourage you to register as soon as possible, because I mentioned the PDMP is going to send us a report on the 24th saying, here's the list of licensed physicians that we know have not yet registered. And so we're going to flag those renewals. Doesn't mean we're not going to renew you, but we'll help you get registered, but we're going to place a hold. We're going to take a look at that license and make sure you're registered. I just sent a link in the chat to the PDMP website, but that website is dchealth.dc.gov/service/prescription-drug-monitoring-program. That is a mouthful, I know. But if you generally just go on the Googles and, as my mom says, and just type in DC Prescription Drug Monitoring Program, it'll take you to the PDMP website, and then you can see a lot more information in depth about how you register. And there are abilities to register for individuals that do not have DEA registrations, for those that are potentially residents in practice and other scenarios. There's a lot of information there, and we can put people in touch with the PDMP program about those registration processes. I am not an expert in the specifics in those, but I can answer as many questions as I can. And if I can't, I'll put you in touch with the people that can answer those questions.
And I will just mention, we've recently heard from some of the folks in DC Health that are working with the PDMP program. They are looking for physicians who are registered with the PDMP and do prescribe. And if you are interested in doing I believe it's a 1-hour feedback session, feel free to reach out to us and we can pass along your information to them. So that program is continually improving and trying to become more user-friendly for you all. We have 5 minutes left. So again, I'm going to summarize questions and group them as best we can, and we will try to, even after the event, get to some specific questions. I want to touch on everyone's favorite topic, which is the CME requirements. 2 questions. The first one is on content of the CME. How do you know if your course fits the LGBTQ cultural competency requirement? And then the second question is more procedural. Basically, how do you upload the certificates? I know, Frank, you mentioned they could be done as one or individually, but is there any other requirements such as format, limits, anything like that?
So to the first part of that question about the continuing education, the content, how do you know that it's going to count? All the CE has to be AMA Category 1 or board approved. And right now the board's policy is that board approval means AMA Category 1 or AOA. And there are some courses that are kind of de facto approved because they're put on by the Department of Health, but the Department of Health goes through and actually gets that approval through another entity. So everything is basically AMA approved category hours. Specifically regarding LGBTQ hours, the way I explain it to individuals is that you have to remember that staff people have to go through these documents and find what is LGBTQ, what is the other hours. And if a document does not say somewhere on its face that it is an LGBTQ course, it's generally probably not going to get accepted. That doesn't mean we wouldn't accept it. If you have documentation that shows this 3-day thing, that this 3-day course included at least a couple hours on LGBTQ competency, and there's an agenda or something that identifies that, then that will be acceptable. We also get questions about, does this subject about gender bias? While we are excited that individuals are taking those courses and we encourage you to do so, gender bias does not necessarily mean LGBTQ cultural competency. It's about dealing with that patient pool and dealing with the cultural issues that go along with it. So that is the focus, the legislative intent. So that is kind of how we direct individuals.
And can I just add that each year people get mailers in the mail that will say, hey, take this course, it costs this much. DC Board of Medicine wants these hours, but often those are private companies that are soliciting your fees. So that's not coming out from us. We have the ones that we have suggested on the website, we pointed them out. And it's not wrong to take those other courses, but I don't want people to feel that DC is, saying, here, have this $500 course. That we're not sending you things to your house to suggest things like that.
Right. Thank you for that clarification. Those are common questions that we receive. We do have time for one more question, and again, we'll follow up with everybody who's asked a question that did not get it answered, or additional questions. This one's a little bit specific, but Dr. Anderson, can you touch on fellows and fellowship? What's the requirements for a fellow in terms of medical license and renewal?
The fellows do need, most of the fellows carry a full license, so they do need to go ahead and do their renewal. And in general, during your fellowship counts as the CE. You're attending your grand rounds, you're teaching, you're in your fellowship. Your fellowship has attested that you're an active fellow in good standing, and so you can submit the CEs that come along with the fellowship. But those are for the fellows that have a full, which are all the fellows that have a full license.
Correct. And to add to Dr. Anderson's comment, I saw there's a couple questions there about like waiver of CE. Do they have to do those? We do not require CE for your first renewal. So if this is your first renewal, you do not have to upload CE. We do count fellows, but as Dr. Anderson mentioned, you have a full license, so we don't necessarily know you're a fellow just because you're a fellow. You need to state as much and upload a document that says that, and so that way we can follow up on that. So yeah.
All right.
Oh, and I will add, that does not waive content-specific hours. Content-specific hours must still be completed. So now the first year is still waived, but if you're going to be a fellow and submit those, you still have to do an LGBTQ course and the 10% cultural competency when that kicks in the next renewal cycle.
Great, thank you. Got that question in at the end there. All right. Well, I want to thank everyone for participating. I would like to thank Dr. Anderson, Mr. Meyers for coming on with us today and giving a great presentation. I'd like to encourage everybody on this webinar, if you are not an MST member, we do these things weekly. We love doing them. We love hearing the topics, but we also do them as part of our providing value. So think about joining MSTC if you are not already a member. We can help you with that. But again, if you have any questions, about this process, feel free to reach out to our presenters or us, and we're happy to help you get through this. And otherwise, everyone have a great night, safe night, and enjoy. Thank you all again for presenting.
And thank you all for all the licensees. Thank you for everything you're doing during this very difficult time. We on the Board of Medicine appreciate all of your efforts, and everyone, we're all in this together. So we want to make this as painless as possible for you, and keep those questions coming. We'll do our best to answer them.
Yeah, I echo everything Dr. Anderson has said, and please check our website routinely. We'll send out more information as renewals approach. And if you have questions, send those to the email addresses on our website. Those are the easiest, quickest ways to respond. So, and thank you all. Keep up the good work. And if I could applaud enough, I would.
Thank you, everyone.
A good place to end it. Thank you, everyone. Have a good night.
You too. Good night.